Unfortunately, there's really not an easy answer to this. First, speaking with your insurance provider directly and then reviewing the policy documents is always going to be best. Most insurance companies have an overview with specific coverage details, limitations, and then the associated costs or co-payments for each visit. Also, telehealth coverage is going to vary from state to state due to licensing requirements and federal regulations. Now, most insurance companies do have coverage for telehealth appointments and are usually covered because the visit can be billed to your insurance like any other routine in-person office visit. This is due mainly to the COVID public health emergency. So virtual appointments or virtual telehealth appointments were minimal until about 2020. Then during COVID, the government allowed almost all medical appointments to occur via telehealth. And then the popularity increased drastically. Telehealth emerged as a crucial solution, allowing patients to access healthcare remotely. Now, this adoption led to a rapid increase in telehealth and utilization, and then it increased the pressure on insurance companies to provide coverage for these services. That same pressure also pushed the government to align its guidelines with the demand for telehealth. So these policy changes have encouraged insurance companies to align their own coverage and reimbursement models accordingly, ensuring that telehealth services are included and accessible to patients. Access is vital here. So here's a very broad breakdown of Medicare, Medicaid, and private insurance coverage. Medicare. Telehealth coverage is generally expanded over the last 4 years. Medicare Part B expanded its coverage for telehealth, allowing access to a broader range of telehealth services. However, coverage for telehealth services under Medicare Part B is still subject to specific rules and requirements, and some services may have limitations or require certain communication technologies like internet, smartphone service, or tablet access. Under Medicare Part C, it usually depends on your particular private insurer policy with Medicare and their agreement between the two for telehealth coverage. Now, Medicaid, persons on Medicaid have experienced a massive increase in overall services provided by the federally backed insurance plan. Now, although coverage has expanded, there are still limitations, sometimes based on the patient's state. Lastly, private insurance. As stated above, this is going to vary from state to state, plan to plan, but nonetheless, many private insurance plans have expanded their coverage for telehealth services to meet the consumer demand and stay competitive in the market. Now, remember, it's essential to review the specific details of your insurance plan or contact the insurance provider directly to understand the coverage options, your out-of-pocket costs, and deductible requirements for telehealth services.